My name is Moise, and today I will be presenting my paper entitled Wearable Bioimpedance Sensing for Quantifying Knee Health in Juvenile Idiopathic Arthritis. So I wanted to first start with the high-level goal for this project, which was to determine if electrical bioimpedance can be used to discern between healthy knees and knees with juvenile idiopathic arthritis. So what is JIA? Well, it is chronic arthritis that is diagnosed in children under the age of 16. Currently, JIA is the most common childhood rheumatic disease, and it affects around 1 in 1,000 children. JIA affects children in various ways, with each child having a unique experience with the disease. Common symptoms of JIA include pain and tenderness in joints, along with joint swelling. Another common symptom of JIA is uveitis in the eye. The work that I'm going to present on, however, focuses on children with affected knee joints, and other affected joints can include wrists, fingers, the sacroiliac joint, and the Achilles tendon. Right now, JIA is primarily diagnosed by a pediatric rheumatologist. However, there is currently a lack of pediatric rheumatologists in the United States. In 2019, the mean driving distance to be able to visit a clinic and a pediatric rheumatologist was over 40 miles. So this creates a need for some other type of monitoring. So in contrast to these limitations of the current diagnostic methods, telehealth provides easier access to clinicians and oftentimes more immediate care, especially since the pandemic. Telehealth has been utilized more as an alternative means of getting care. Additionally, wearable at-home monitoring systems have emerged more so recently as a means for providing users with their physiological data that they would otherwise not have. And these wearable systems can be helpful in assessing patient disease status when access to a clinician is limited. So with the work that's presented today, the overall goal is to eventually be able to provide patients with an at-home system that is able to provide clinicians with the status of their JIA virtually. This work provides the proof of concept that electrical bioimpedance can allow patients this flexibility. So now, what is electrical bioimpedance? Well, EBI is a non-invasive method for assessing the composition of biological tissue based on the injection of a small amount of current and measuring the resulting voltage drop across the electrodes. For the system that we used a device that was developed in the Inan research lab at Georgia Tech that utilizes an 805933 impedance analyzer integrated circuit chip, along with some custom analog front end to perform 4 electrode bioimpedance measurements. So 2 of these electrodes, a current and voltage pair, were placed 1/3 distal from the knee joint and 1/3 proximal from the knee joint. We chose this 1/3 distance for measuring because the subjects that we used were in the pediatric population, meaning they had a wide variety of heights and weights, so we wanted to ensure consistency in these measurements. The system that we used had frequency sweeps from 5 kilohertz to 100 kilohertz. However, for our analysis, we used the 5 kilohertz and 100 kilohertz frequency only. From prior literature, we knew that the 5 kilohertz frequency is able to travel through this extracellular fluid, and the 100 kilohertz frequency is able to travel through the extracellular and intracellular fluid. Knowing this, we were able to get a better idea of kind of what's going on inside the knee joint. So why did we use EBI? Well, when we had a subject at the clinic, the treating physician was given a form that assessed kind of symptom severity for different metrics and different things that they look for at the time of the visit. And the scores that they gave us ranged from 0 to 3, with 0 being that the symptom was non-existent, to 3 being that the symptom was very symptomatic and very severe. And these scores were for synovial thickening, which is a swollen, inflamed synovial membrane, as you can see on the right side of the slide. Fluid and effusion, which is an abnormal collection of fluid in the hollow spaces or between tissues of the body. Limited range of motion and tenderness. So we were given these scores that were evaluated by the clinician, and then specifically for electrical bioimpedance, we're looking at the synovial thickening and the fluid and effusion scores. And these 2 scores are most important as it pertains to bioimpedance because current is able to travel more easily through fluid and swelling due to the fluid and swelling having less resistance, Therefore, the resulting impedance will be lower. And so this characteristic is what was able to help us determine whether a knee is healthy or arthritic. So now moving on to the project protocol. Based on prior work that was done in the Inan research lab, we know that the way that fluid moves in the joint changes with regards to how the joint is positioned. The changes in the fluid provide us context on swelling and disease and injury status. So for this study, we took data in the flexion and extension positions and representative screenshots from the animation that was used to guide the subjects to flexion and extension are shown on the bottom. We took this data on the EBI device and it was stored locally and then later transferred to the laptop for data processing. For the subject recruitment, we recruited subjects within ages 5 to 21. We recruited 8 healthy subjects and 23 subjects with JIA. Out of these 23 subjects with JIA, 8 had 2 inactive legs at the time of the visit, meaning that both of their legs had no symptoms of JIA. So for our analysis, the flexion extension positions that I talked about before allow changes in fluid movement to be captured because children with JIA have more fluid swelling and synovial thickening in their knees. The fluid in their knees has greater movement than the healthy knees. And this information is kind of what we can use to help reach our goal of determining if we can see a difference between healthy knees and JIA knees. So we evaluated each leg for this independent H alpha value, which based on prior literature by Mabrouk et al., we looked at the ratio of impedance ranges from 5 kilohertz and 100 kilohertz. And the predicted delta R 5 kilohertz when compared to delta R 100 kilohertz for JIA subjects is higher than healthy subjects due to the extra fluid in the knees of children with JIA. So for our results, we were able to see statistically significant differences between the healthy H alpha score and the JIA H alpha score. However, you can see a definite overlap between the two groups. Some hypotheses as to why this occurred. In our healthy group, we had several athletes, and in sports, you can accumulate fatigue and inflammation, and that does impact the baseline bioimpedance. In the future, we could separate these groups based on activity level on the healthy side, and on the JIA side, we could separate based on inactive versus active disease, which we did not do here. Additionally, some limitations obviously include the sample size. We only had 10 healthy legs after all the filtering was done. Future work can expand upon this data collection effort to include more healthy subjects on that side. And as I said before, 8 of the 23 subjects with JIA had the 2 inactive knees. So that could also impact the separation between the two groups. And briefly, I want to mention the longitudinal aspect of this study. In the same sort of basis, we wanted to measure bioimpedance from subjects during multiple visits in order to see if we can assess the disease status throughout the course of treatment. So for this side of the project, we were able to collect data from 4 subjects throughout multiple visits. And then compare their H alpha scores and compare their impedance scores against each other to see if we can see any changes. So specifically for this subject, we were able to record their bioimpedance the day they had a fluid aspiration from their knee. So we recorded the baseline bioimpedance before they had fluid aspirated, immediately after, and then they returned to the clinic 1 month after for a follow-up recording. And as you can see on the bottom graph, that the 5 kilohertz resistance of the inactive leg stays the same from recording to recording, and then the active leg's impedance increases, indicating less fluid was found in the knee. The H alpha score for the inactive leg stays relatively the same, while the active leg ends up matching the inactive leg after treatment. So overall, we were able to do this with 3 other subjects, and you can see a positive trend that indicates a positive change in disease status with the H alpha score decreasing as the time goes on. And these results can tell a clinician whether or not the treatment is working and whether alternative methods of treatment should be considered, depending on if the H alpha score indicates a positive change in disease status. So in conclusion, in this paper, we demonstrated for the first time the capability of electrical bioimpedance to provide insight into JIA disease status and treatment effectiveness. And we hope that wearable EBI can be used in the future as a method to help reduce patient suffering. And briefly, I just wanted to thank the other co-authors on this paper and the Patricia Bowman Terwilliger Family Foundation for their financial support. Any questions?